nearly as charming as Dr. Zeinoun, nor can I stand for this long today. Thanks for inviting me, first of all. I really like that there's a really nice turnout. I'm glad you guys are excited to hear us talk. No one else usually is. Yes, me and the PSS wrote my section as psychological assessment, and at first I'm like, well, that's actually a function, not really a field. But I'm glad that they did it this way, because I get to talk about psychological assessment as it pertains to different applied fields. Dr. Haitham said that he worked in assessment and validation. I'm sure you know a lot of clinical psychologists work in that. And so what I'll try to do today is tell you the different, where psychological assessment fits into different fields in psychology, and tell you a little bit about how I pursued my career. Today, psychological assessment is mostly used in what is called clinical neuropsychology, which is a field that aims to understand brain behavior links, especially in populations that have acquired illnesses such as traumatic brain injuries or brain tumors, effects of radiotherapy, etc., or developmental illnesses such as congenital illnesses, learning disabilities, and so forth. And what neuropsychological assessment does is that it tries to understand or measure the different cognitive functions of the person and link those to their ailments and provide diagnosis and recommendations. Now, the same tests or tools are also used, for example, by clinical psychologists or therapists. And in those cases, often they use tools related to psychopathology, to personality, to psychiatric illnesses, in order to also make treatment planning for therapy. And those same tools are used in I.O., for example. Not same tools, but I.O. psychologists would measure personality, would measure ability, would measure stress levels, well-being, in order to also make decisions related to people's career development, people's recruitment, a job personality fit. You know much more about that than I do.
Great job.
So the psychological assessment is used like that in I.O. Also, educational psychologists will use assessments to also look at usually developmental issues such as learning disabilities or ADHD, and they use the same tools and look at them from a different perspective than clinical neuropsychologists. And last but not least is the most fun for me, which is psychometrics. And psychometrics is a field that is concerned not with using tests clinically or in applied settings, but it's developing the tools themselves. So many of you have taken the SATs, GREs, GMAT, or whatever. Somebody comes up and actually constructs these tests and establishes their validity, their reliability. Just as somebody does these tests, people actually do the IQ test and personality test. And these require a lot of skill and a lot of statistical knowledge in order to do a really good job at it. And this field is, there's a lot of need because there's not enough experts in this, particularly in our region, because as you know, a lot of the tests that we use are just imported from abroad. And so we have to do them for our populations, and that really requires a lot of statistical and psychometric expertise. So these are the 5 different fields in which you can use psychological assessment. Now, so you can't just go and do a master's or a PhD in assessments, right? But you can do in fields in different fields, and then focus your applied work on that. So if you're doing I.O. Psych, you can choose within I.O. Psych to focus on assessment of talent or assessment or using assessments in the workplace. There's clinical psych programs that have a focus on assessments. There's clinical neuropsychology that focuses on assessment as opposed to rehabilitation. So you can focus your field within that. So how did I get where I am? I went a little bit in a zigzag way, as I think you might hear from many of us. And what I tell students a lot of times is it's really unfair to decide what you want to be when you're 18. I didn't know anything. I just went in, I know I like psychology. Yeah, well, I know nothing about psychology. So you go in and then you start taking different courses and you're influenced by different professors and by different topics. And at that time, I did my BA and I thought I wanted to be a therapist, which I think what a lot of people entering psychology wanted to do initially. Because for many reasons, this is what we know about psychology. So I did that. I just did psychology. I wanted to be a therapist. And I remember very well that I went to the Institute of the Cross, Mustashfa Dar al-Salib, and for a visit. I was part of a practicum. And when I went, I'm like, yes, I love this. This is where I want to be as a clinician, not as a patient. And and this is it. This is what I want. So I went on for a master's degree. At that time, why I didn't go for a PhD was probably either financial reasons or I just was not aware of what I needed to do, right? You know, this is, what, 12, 13 years ago. So I got a Fulbright scholarship as well, and I went and did my master's in clinical and counseling psychology. Now, why clinical and counseling? I chose that the school that I went to is also a state school. It's not an Ivy League school, but that particular program was the best in terms of its accreditation. These are things you need to look at. It was accredited so that when I would graduate, I could become licensed in conducting therapy. So I did that master's. I did 2 years of practicum with that master's, and I became a licensed clinical counselor, is what they call it in the Midwest. And so I came back to Lebanon. I did that for a couple of years, along with testing. So you know, you do a lot of things when you first graduate. You're not really specialized. And then I also realized that I don't like therapy very much. I liked it during the practicum. It was exciting. It was fun because I was curious. But then I discovered that the part that I like is the initial part, solving the puzzle, figuring out what's going on. The part where I have to help them with it, it was all right. It was all right. But I don't know, the therapist can speak more, but it wasn't very rewarding. Maybe I wasn't really good at it. Otherwise, it might have been rewarding. It wasn't. Well, I think I was good. I don't know. What I liked was the puzzle, the initial, to figure out what's going on. And that initial puzzle, whether if I'm doing behavioral therapy, is figuring out what comes before the behavior, after the behavior, what gets them to do, what gets them triggered. And I started working more with tests, the diagnostic tests, because the tests are the part that I like, the puzzle. And as I worked with tests, I discovered this is really what I like. It is more structured. It is more, in my opinion, important to have a really nice diagnosis or solving the puzzle at the beginning. I did that for a few years, and I'm like, okay, now I think I would like to move on to academia. And that's when I decided to pursue my PhD. So I worked in practice before I went for my PhD. Like, okay, I think I would like to do more research. I think I would like to enter academia. I applied for a PhD program in the Netherlands, and I chose that particularly to work with a mentor who is known for constructing tests in different cultures. So I took my knowledge in applied testing, and I wanted to use that in research. So I worked with Frans van de Vijver about 4 years. And that PhD program, unlike many programs in the US, in order to graduate, you need to have 3 published empirical papers. So it really prepares you to be a scholar. It prepares you to enter academia. I graduated about a bit more than a year ago. I think it was last September or so. And then I joined here. And I still wear 2 hats. I love academia, I love research and teaching, but I don't think I can teach just out of a book. I continue to hold clinical duties, and I do see patients, and I only do assessments and testing. I solve the puzzle, then I send them away to others. And I also teach and do research and service. So that's me. In terms of, if you want to know more about these fields, you can visit a few associations. The International Neuropsychological Society, the International Test Commission, and the APA, different divisions, division 52, 40, something. Oh, yes, I forgot. And if you would like to know more about salaries, you can use O net. O. If you just Google O net. 1, 2, all right. 1. You will see that IO psychology and clinical neuropsychology are one of the fastest growing fields within the field. Forensic neuropsychology particularly also booming, so you can get information like salaries and things like that. The part I hate most about my job is writing lengthy reports. Other than that,